So we're going to provide you a recorded training on how to use HealthServes to manage your pharmacy operation, and the training will cover from start to finish of the training, but we'll have to make it as brief as possible. But remember that HealthServes is your one-stop shop for health information management in the pharmacy, hospital, and medical laboratories. So let's start from the beginning. The first point in the deployment process is registration. And to register your institution on this platform, you have to visit HealthServe as written. Please remember to put s.org. You enter on your browser. You can use any browser. So once you are on healthserve.org, you proceed to register. But on mobile interface, you will see an icon like a square on the right side of your top right side of your screen. Click on that icon. It's going to drop this menu we have here at the top in the computer interface. So click on institution registration to onboard your organization. And when I mean organization, I'm referring to your pharmacy, your lab, or the hospital. But the focus of this particular demonstration will be on pharmacy. So go ahead, fill this form you're seeing on your screen, and remember to check this "I am not a robot" checkbox. Check it, and then you click on register institution, and then you are going to get your login ID for your institution. Then proceed to login. So at this stage, remember we're doing it from the beginning. We're expecting that you have already gotten your login detail, and either login with the ID or the email of your organization and the corresponding password. So now I'm logging into an institution for us to start the training proper. So I click on the institution ID, and this is the password for it. I've already logged into it before. And then also check "I'm not a robot" checkbox. Go ahead and log in. Now you're in your institution. As a new onboarding institution, you'll be expected to activate your account for you to have access to all the menu we'll have here. So now the first thing you need to do, this by default is in a mode that will take care of whatever you need to do. But if you want to change it, this is actually for you to selectively give access to clinical information of the patient to your staff. So for instance, as it is right now, if someone is a nurse, it means that the person won't have access to clinical information based on this current setting. But you can simply give access to nurse in this institution by toggling clicking the toggle button and to turn it on the right, so that you can have access for that group of staff. Please leave this formatting as it is. It helps to ensure that nobody outside your institution will have access to your record. Once that is done, the next important thing you need to do is to start onboarding your staff. There are two ways to go about this. Just the same way you create your institutional account, they too can create their account, and if they do, they simply give you their staff ID they got when they created their account, and you simply enter that ID here and click enroll staff, and the job is done. But in the alternative, if you choose to go the other way, which is to create a folder for that staff from scratch if they don't have one, then you can fill this. But ensure you use your email and phone number to populate this staff registration form. Once that is completely done, some fields are actually optional. I will give you an instance. Like professional registration number is optional. National ID is optional. Then other name is also optional. Other name is optional. So once you fill this form, even image is optional, but it's important you know which of your staff you're working or seeing the person's folder, but it's optional. So once you are done doing this, you click on add staff, and once you add the staff, you will see the person profile listed on this your staff database. This is your staff database, But in the event that you have any of this staff which you have enrolled leave your organization, you have to remove the person from here so that he will stop being a member of your staff team. So how do we do that? You click on delete staff and you click yes, but if you click no, I'm canceling it. So by so doing, you will remove any staff that is no longer part of your team. Then, because we are focusing on pharmacy usage, I may not dwell much on services or setting that has to do with other type of organization like hospital and lab, but I will just give a quick description. This is select medical investigation staff. This allows you to assign roles that has to do with medical investigation in terms of lab tests, ultrasound, x-ray to your staff. Then after you have done, and how do you do that? Simply click on this toggle button and you give them access to a particular area you want them to operate in. Then that's gone. We now look at service price setting, how to set price for your services. So, and the function is called set service prices. So you can go to lab section and you add prices to various tests that you provide. You can see where you add price column. This cost column is optional. You don't really have much need for it, but the one that is important is the price column. So go ahead and populate all the fields for various services you provide with the amount you use to provide that service. And once you do, at the end of the page, click on update all. So after putting the price, don't forget to click update all for it to take effect. So the next, you click on next option. So next option means moving to the next page. So you go ahead and do the same thing for the next page. Once you finish, click on update all, or you move to the next one until you get to the last end of the service you're updating the price. When you are done, go back. You can see vaccination. If you are providing vaccination and the client pay for it, go ahead and open it and do the same thing for that. Do the same thing for x-ray, ultrasound, and for services that are not listed here, you can create one for yourself by clicking on add a new course. You create a service for that, and then at the point of billing, you can use it to bill a patient and of course generate invoice for that. The next one is a modify lab reference. Here you can actually change or modify the lab reference. By default, the system has lab reference for all lab tests. But if your machine has a value that is different from default value, then you need this tool to modify it. And now the documentation record. For everything you're doing with this system, this software keeps record of all of that, like patient register. When you're registering patients, system is keeping that record for you. All the patients registered by your staff are being stored here. Their name, their gender, their phone number, their email, and this will make it easy for you to conduct mass outreach to your patients by simply exporting this in Excel form, in CSV, or any other format you like that you can use to work on this file. So, but beyond what I just described on terms of patient register, you can see there are also family planning database, there is vaccination, there is poison report, inpatient admission, drug recall, and so many other types of data you have here. Vital sign report, referral report, treatment report, and so many other database. This is where you have your data, and more we see coming as we go on this project. Then the next is public health. But another one very important tool here is telehealth service search. What does this really mean? This means that general public who are looking for hospital to provide a particular service to them can come here and search for hospital or the provider that meets their requirement, and they will book appointment to consult you, and they can even chat you up even before they book the appointment, and they can use this our services button to see what you provide. Same goes for pharmacy. The medical lab have their own category, and then the healthcare professionals. Now, for those who have already booked you, this is where you see the list of all the booked appointments, and this is where you can now use inbuilt communication tool to actually provide consultation to the patient or the client virtually on this system. So, and you now have also patient visit record. This system helps you to keep record of all the patients that have visited your institution in real time. Drug labeling. There's also a comprehensive tool to help you label your drug, both prescription and non-prescription labeling. You have it covered here, and there's a system for you to actually set the label template the way you want it. Manage appointment. This helps you to keep track of all the appointments given to patients in your institution. Communication setting. This helps you to adjust the way you communicate to others on this system. Then health insurance option. This helps you to delegate staff to manage health insurance operation in your organization. And then HMO capitation fee setting. This helps you to set capitation fee for various HMO that work with you, meaning that they send their enrollees to your organization. HMO capitation billing. This helps you to generate the monthly report of the bills that the HMOs are supposed to pay your organization. Then enroll or delete HMO. This helps you to enlist the HMOs. This helps you to enroll patients that are sent to you from HMOs that interface with you. Then HMO bill management. This helps you to keep track of bills that various HMOs will pay your organization. Then the next one is patient bill. This keeps track of all the bills paid by the patient in your institution, both paid and unpaid. You can track them here. Even at the level of the patient, you can see the comprehensive bill of each patient. Revenue collection by your staff that are in your system. You can see how much each of them has collected in various payment mode, maybe card, POS, transfer. You see that here. And for those who partner with other healthcare providers, you will see the commission setting for various partners you are working with that you give commission for referrals. Earned commission by these partners, you have it here. Paid commission by these partners, you have it here. Right? So we're moving on. Referral earning. We also want to let you know that you can actually use health. You can make money by referring other users to HealthServe, and you can see those you have referred here. They will be listed here, and those who have actually paid for the service, you will see that they are paid here, and the money you earn, you can see this person earned 950 for instance, because this person has paid money and he earns 10% of that amount. So you can see those you have referred, and you can withdraw your money to your bank account from here. Once you have earned money from referring people to HealthServe to use it to run their organization, you simply fill your account number and request withdrawal amount, and HealthServe will send the money to your bank account within 24 hours of submitting your withdrawal request. Then here you have your staff activity evaluation. So you can see in real time what each of your staff are doing at their own system in real time. Then telehealth consultation. Here you can actually consult your existing patients in real time using our telehealth system. So having come to this point, it's now time for us to see how will your staff manage your patient on this system. So I'll be logging into staff account for us to do justice to that. So you click on this icon at the extreme end. As I've just done, you see these three pop up. Locate log out, and then you are logging out of the system. So click on log out. So now that I have logged out, it's now time for me to log in with a staff account in this particular institution. So that is my staff login. The password is here, and the system is built in such a way that it synchronizes your staff login with your institution as long as they remain enrolled in your institution. So the moment the staff put their ID, system will pop up the institution ID where they have been enrolled. But before they log in, they need to check I am not a robot for security reason. So the staff will go ahead and log into their system using their mobile device or their computer. So having logged in, the one important thing staff will be doing for you is for them to register new patient. So you can see register new patient. That is the first and foremost what they will be doing in your institution, so they can now have your patient register be updated in real time. So once they use this form to add a patient on the system, automatically that patient become one of your patients in the database. Right? This is the patient visit register that we saw before. But now on the staff interface, our aim is how do you add patient? We have done that. Now is how do you attend to patient? So we click on attend to patient. This is the button to attend to patient. Attend to patient. Once they click on that, they have two options that are popular among users, which is either to attend to patient via patient ID or phone number. But let's use phone number option, because this will be easy in the sense that patient can easily remember their phone number. So they have to go ahead and input the patient phone number as I'm doing now. So once they key in the phone number, there won't be need for any default password. Remember, when registering a patient, there is need for default password. You can use anything you like, maybe their surname, their combination of their surname and their phone number, whatever that they want to use as their default password. They have to use that to make sure that nobody can access a patient folder without due authorization. So once that is done, at the point of attend to patient, simply put the phone number and click verify, and you retrieve the patient folder as we have it now. And we're also looking at futuristic patient care management, in the sense that we get to a point where you can actually consult your patient from the comfort of their home, and that is why we already have video calls. So once you log into a patient folder using their phone number, when you want to consult them, simply click on start video call. You can now start the consultation. They will see them, and you'll be seeing them, and they'll be seeing you. And then you take record of whatever you are doing by going to create new record. So once you on this create new record, everything you want to document are here. You can see if you are providing point of care services, these are the two: glycemic control, kidney function, kidney, liver and cardiac risk factor screening, coagulation and liver function tests, DVT-PE, that's the thromboembolism. This to help you know if somebody have risk of blood clotting. That is what this test is about. Acid-base balance, ketoacidosis, anemia, cardiac marker, liver function, pancreas function, clinical chemistry, urinalysis, thyroid function, malaria screening, pregnancy test, fertility screening in women, ovulation test, fertility screening in men, genetic tests related to infertility, viral infection screening, syphilis screening, strep A, pharyngitis screening, hepatic ulcer screening, staph and micrococcus species tests, and so many others. This come under point of care testing. Therefore, when you want to request for a lab test, this is for that. Medical investigation, you can use it to do that. Even X-ray, ultrasound, that is covered there. The next is prescription. So, and it's very simple to do. Simply click on add item when you want to prescribe drug. Type the just 3 alphabets for the name of that drug. The drug name will likely pop up. So I'm looking for instance, paracetamol. So I have written para. So having written para, I can see that all kinds of paracetamol brands are popping up on the system. So you click on that. Paracetamol 500 mg tab. Dosage. So I write 2 tablets. Once I write 2, the system will give me the right input for me to populate this. So 2 tablets every 8 hours. Then how long will it take it? Maybe for 4 days. So I just write 4 in words. You can see I have 4 days already there for me, and I'll add. Then I want to add another drug as well. Maybe this time around Ciprotab. So I write Cipro. Once I write Cipro, it will give me the right option for what I'm looking for. So that is a various type of Cipro based drug, and I'm looking for Ciprotab. Let me put tab so that you can further refine it down to what I'm looking for. So this is Ciprotab. Ciprotab 500 mg. What is the dosage? 1 12 hourly. Then duration, assuming it's for 5 days. So I put 5 here in what? 5 days. And I add. So you can see I finished the. So this will help you when you add your drug you are dispensing to patient this way. You will keep record of what you are giving them, so that if they come back tomorrow, you can actually keep track of the services you have provided to them so far. So having added this, you can see there are many tools here: nutritional management, poison book, pharmacovigilance, vaccination, family planning, pharmaceutical care, and so many others, even appointment management. All that is here. So having done all this, I need to now save this documentation so that I will save it on the database. I've done that. What next do I do? If I want to build this patient so that I can go and pay, this same approach applies to other services like lab tests and all that. So you can see paracetamol, assuming is 200 naira per one, and then I'm giving 2 sachets. That is done. Ciprotab, let's say it's 2,000 naira, and I'm giving 1 pack. That is done. So total amount for this is 2,400. So if you have any partner that refer patient and you need to pay money to them or pay some percentage, this is actually provision for you to do that. So let me just explore that. Select a partner. Maybe you have ABC Pharmacy as your partner. You click on add. This tool is actually optional. If you don't have any partner listed, this tool will not even come up in the first place. So add to bill. That is the amount. Patient is paying it out of pocket. There's no health insurance attached to this. So you add to bill. Done. So quickly go down and save it. There are other type of bill that we have passed here, maybe like vaccination, lab test, X-ray, ultrasound. So you click on save bill. Done. So once it's saved, for those staff that are in the account department, they can easily go to receive bill and they will take care of that. You can see receive bill. When they go to receive, you can see the amount. Prescription, receive bill. They go ahead and collect the money. Cash transaction or any other form of transaction can select, but I'm using cash. So I save. Okay. Okay. Done. You can see it's paid now. You can print invoice from here. That is the invoice for the drug purchase. That is the invoice. So you can print the invoice with thermal printer. You print the invoice. And for those providing health insurance, this will help you to show evidence of work done if you're providing health insurance. So you print the invoice, right? So you have seen how to use HealthServes to manage patients. Once your staff log in, all they need to do is to add patients using register new patient function. Register new patient using this form, and they fill it up and ensure they put default password. They put what? Default password. They will key it here and here again. And that default password can be just anything. Phone number, first name and second name. Whatever you want, you can put it. But it's just to provide security for patient information so that nobody can access it without due authorization. But ensure you share your patient ID with them so that they too can log in into their device and interact with you in real time. Once you add a patient, the next thing you need to do is to attend to patient. And once you click on attend to patient, you can use any of these options, either phone number or patient ID. Click on phone number option, enter the phone number, and then click on verify. I'm trying to recap what I've done so far. Create new record. You use all the tools you need here to document. Once you finish documenting, simply click on save documentation. Whatever you have documented will be saved in various files where they are going to. So for now, I am coming to the end of this demonstration regarding how you can use this tool to manage your operation in the pharmacy. Watch out for more video in future demonstration. Thank you.